Hello, everyone. Welcome to Meditales with the Portatile Doctor, where I will review the accuracy and realistic feasibility of medical contents found in scripted and unscripted works, such as movies, TV shows, adverts, novels, and books to facilitate public health education. Don't forget to visit our website and blog today. So, moving on to something exciting, we will be reviewing. Can I get some drum rolls, please? Being Mrs Elliot, a 2014 Nollywood movie directed by Omonio Boli and produced by Namdi and Omonio Boli. We draw attention to when Mrs. Lara Elliot and Miss Fisayo get involved in a road traffic accident on their trip from Asaba, Delta to Lagos, and the medical-related events that ensued. The driver of Mrs. Lara Elliot's vehicle will be referred to as Driver A, while that of the colliding truck will be referred to as Driver B, as these characters were not named in the movie. The establishment of the predisposing risk factors for the accident is clear and easy to appreciate, which includes poor coordination of Driver B and the distracted driver A in a poorly lit road in the evening, unstrapped backseat passengers, and the mechanism of trauma would imply a collision at high speed that led to the severe impact and resultant damage to property and lives. We do not know the outcome of the other victims of this accident except for Mrs. Lara Elliot and Miss Fisayo, although this is not likely to change the narrative. However, this would have been a likely inquiry that would have been made by the emergency medical service first responders in reality. We learned that Miss Fisayo is severely burnt beyond recognition, especially face, neck, and left upper limb, while Lara surprisingly suffers no burn injury. This is a rare occasion, not likely to happen in reality, but well, we're going to let that slide. However, if Miss Fisayo was thrown into the heat of the fire that resulted from the accident as displayed by the location of her body post-trauma in the movie, then this makes the scenario more plausible. Nonetheless, Mrs. Lara Elliot, subsequently named Angelica, post-trauma appears to have suffered a traumatic brain injury for what is learned in subsequent scenes, that is, her days of unconsciousness and memory loss. This is also plausible in reality. Miss Fisayo is severely burnt beyond recognition. It takes the identification of a familiar wedding band for Mr. Bill Elliot to assume Miss Fisayo to be his wife, Mrs. Lara Elliot, which he logically maintains despite the odd differences, given the nature of trauma made explicit at the television show Exposing the Truth, shown towards the end of the movie. We follow the response of the EMS team, first responders at the accident site. The mode of patient transfer on a spine board and oxygenation is likely in reality and quite good and properly depicted in the movie. Endotracheal intubation and entrained oxygen would have been more ideal in this condition, but well, we're gonna let that slide. It would have been ideal for the EMS team to secure intravenous access for fluid resuscitation and monitoring devices while en route to the hospital. The transportation and swift movement through the emergency department to the intensive care unit is commendable and should be the ideal in reality. The restriction of movement into the intensive care unit and the disposition of the first reviewing doctor, we would name Dr. A as no name is given in the movie, is probable in reality. We take a sneak peek into the room of Miss Fisayo, where Miss Fisayo is nursed. It is hard to appreciate in close details the care rendered. The monitor in the room is turned on, but it is hard to ascertain if any monitoring parameter is in fact being read or shown. We appreciate a brief scene of the pre-operative review by the reconstructive surgeon Dr. Michelle and brief clips of the commencement of surgery in an operating theatre. The characters are well propped for the designated activity. The viewer can appreciate the air of seriousness in the operating theatre. One sad observation is, however, noted. The monitor is turned on but appears not to be in use or connected to the patient, as the various parameters are flatlined without a reading. This is a major oversight for such a major surgery, and this is unlikely in reality. Upon revision of the Operation Moonsight following facial reconstructive surgery, we see that she was not intubated with all orifices to the airway covered, that is, the nose and the mouth, by the facial wound dressing. This is an omission that would have grave implications in reality. An endotracheal tube in place would have been appropriate with or without mechanical ventilation. No monitoring device is attached to Miss Fisayo, and she appears to be nursed in a private room without a transparent glass wall, if not nursed in an open wall to enable continuous nursing care for such a critically ill patient. This is unlikely to occur in reality. One might argue that with the percentage burns demonstrated to be suffered by Miss Fisayo, why was only a facial reconstruction done? What happened to the other burnt skin surfaces? These questions are left unanswered. Multiple stage surgeries would have been the case in reality for such a major burn injury. We didn't get to appreciate Ms. Fisayo's experience of her severe burn injury prior to her facial reconstructive surgery. Hence, the clarity of the condition's symptomatology and chronology cannot be evaluated. A lot of psychological and musculoskeletal injury accompany major burn, which was reflected in the movie. We learn that it takes several months before Miss Vitayo returns home. This may allude to further care rendered. The duration is probable in reality given the nature of injury, although the viewers did not get to appreciate the weight of therapeutics and rehabilitation that is associated with surviving and recovering from such a major injury. Viewers do not get to see follow-up outpatient clinic visits by Ms. Fisayo upon discharge, which would have occurred in reality. More so, we found out that she resumed cigarette smoking, which she should have been advised against at a follow-up clinic visit. The reasons Mr. Bill Elliot stated in the Exposing the Truth television interview on his failure to identify his wife's imposter are medically plausible with the extent of post-traumatic stress that she might have experienced that might have altered her behavior. The production team as well as the actors and actresses made a good effort at medical correctness. So the overall rating of the level of medical accuracy in this movie would rate it above average. So, what are you waiting for? Visit us today at www.posita.org.ng. Posital, quality of life getting better.